On this Wednesday night, a COVID-19 vaccine no longer a long shot. The UK leads the world, the first to approve the Pfizer BioNTech vaccine.
Help is on its way.
Who gets it first? How challenging are the logistics? And could Canada be next to give the green light? The crisis inside hospitals, how the virus is hitting healthcare workers hard. A daughter's powerful message.
If we're able to put somebody else's welfare above ours, just like my dad did every single day of his life, that's what's going to get us through.
The sorrow and suffering over COVID-19. And Ottawa's broken promise, why some First Nations will have to wait even longer for clean drinking water.
Global National with Donna Friesen.
Good evening and thanks for joining us. It is the day millions have been waiting for. The United Kingdom is the first country in the world to approve the Pfizer-BioNTech vaccine for COVID-19, a vaccine that has been shown in trials to be 95% effective. The vaccine has been authorized for emergency use in the UK. The British Health Secretary says the first 800,000 doses will be ready to roll out to the public starting early next week.
This is a monumental step forward. It's no longer if there's going to be a vaccine, it's when. This is a day to remember, frankly, in a year to forget.
It is a massive breakthrough, considering the world hadn't even heard of COVID-19 a year ago. The scientists at Pfizer and BioNTech did in 10 months what usually takes 10 years. Millions of doses are already in ultra-cold storage in Belgium and will be shipped to the UK in thermal boxes as early as tomorrow. There are huge logistical challenges, though. This vaccine is the one that must be stored at minus 70 degrees Celsius. Because of that, the UK says the first vaccinations will take place in hospitals that have the facilities to store those vaccines, and that means the most vulnerable residents in nursing homes will have to wait. This same vaccine is one of 4 candidates going through the approval process here in Canada. In a tweet today, the federal health minister called the UK approval encouraging. Patty Hajdu says Health Canada's review is ongoing and is expected to be completed soon. We'll get to Canada's vaccine plan in a moment, but we begin in the UK, where the biggest immunization program in history is about to begin. Goomansingh has tonight's top story.
The Prime Minister, who himself almost died of COVID-19, is now leading the world down the path of a mass vaccination program.
It is the protection of vaccines that will ultimately allow us to reclaim our lives and get our economy moving again.
Britain granted the Pfizer-BioNTech vaccine emergency use approval. The move follows months of unimaginable grief. The UK has the highest official death toll in Europe.
The safety of the vaccine has been scrutinised independently by our Commission on Human Medicines, and no stone has been left unturned. So absolute confidence in the safety, effectiveness and quality of the Pfizer-BioNTech vaccine.
Next week, around 50 hospital hubs across England will start offering the vaccine to the over 80s and to care home staff and others identified.
Vulnerable care home residents and staff are a priority, but officials haven't figured out how to widely distribute the vaccine, which must be stored at an extreme minus 70 degrees Celsius. England's Deputy Chief Medical Officer explained the problem like this.
This is a complex product with a very fragile cold chain. It's not a yoghurt that can be taken out of the fridge and put back in multiple times. It's really tricky to handle.
Officials say if enough people take the vaccine, deaths can be prevented, and so can long-term health issues related to the virus.
I have high hopes that eventually the vaccine will make a very, very significant difference to the way we live our lives.
Vaccinations will start early next week and continue for months. It's hoped that in time, other vaccines will be approved, including some that don't require ultra-cold storage, making it easier for people to get the shots. Goomansingh, Global News, London.
Canada has pre-ordered 20 million doses of the Pfizer vaccine, and it is one of 4 vaccine candidates Health Canada is reviewing. The approval of the Pfizer vaccine is expected to come around the same time as the U.S. and Europe, with government officials insisting that, of course, safety is the top priority. As Abigail Bimman reports, there are questions about how the vaccines will be rolled out, when and if they are finally approved.
The leader of the New Democrats is calling for a new Crown corporation to manufacture vaccines in Canada. And in the meantime, Goomansingh wants more details about the plans for vaccines we'll get that aren't made here.
There is no clear plan. Who is going to receive the vaccine? What choices is this government going to make? What is the rollout going to look like? All these questions are still unanswered.
Health Canada is looking at 4 different vaccine candidates. Canadians will be covered on vaccines.
It's always too slow when you're not first. It depends how you see it. I still think that it's important to take the time.
Gary Cobinger says being a few weeks or months behind the UK won't change much. But the microbiologist who left Canada's vaccine task force over concerns about transparency says the government could do a better job of keeping Canadians informed.
People need to know so that they understand what the challenges are as well. They can be explained what the challenges are, and they can understand why things are not happening at the same speed at all the locations.
The bigger the herd is going to be critical as we sort of move forward with this.
The head of the Industry Association for Canadian Biotech says he's worried about a challenge further down the road, anti-vaxxers or vaccine hesitancy.
When we get to the point where it is, available to everybody, but not everybody's taking it, that's when I think we've got a bit of a challenge.
Why did this Prime Minister cost Canadians 5 months in the vaccine race?
While the opposition leader has been touting the importance of a vaccine to combat COVID-19, one of his caucus members, Derek Sloan, sponsored a petition questioning vaccine efficacy and safety, claiming bypassing proper safety protocols means COVID-19 vaccination is effectively human experimentation.
I haven't read it since I tabled it there a couple of weeks back. I think there's some good points in there. I'd obviously have to look at every single point to tell you if I agree or disagree.
The petition so far has 22,000 signatures, exposing a divide when science is leading the federal pandemic response. Abigail Bimman, Global News, Ottawa.
If and when Canada approves a vaccine, getting it to everyone is going to take time. And while we wait, Canadians are still getting sick and dying. In Ontario, for the 6th day in a row, more than 1,700 new cases of COVID-19 were reported and 35 more Ontarians died. That brings the death toll in Ontario just in the past 7 days to 144. With case numbers rising fast, some Ontario hospitals say beds are full, ICUs are over capacity, and elective surgeries are being cancelled. Despite that, the province's health minister denies there's a crisis.
You want to speak about who is in crisis? Have you taken a look at Alberta, where they're doubling up patients in intensive care units? We're not doing that in Ontario.
Alberta is dealing with a record surge in hospitalizations. In the last month, the number of COVID-19 patients there has more than tripled. As of tonight, there are 504 patients in hospital. 97 of them are in intensive care. Alberta Premier Jason Kenney said today he expects the first doses of the vaccine will arrive in his province on January 5th or possibly before that, though of course nothing has been approved yet. In the meantime, his health minister said there are talks underway about contingency plans for tents to house field hospitals.
They've begun conversations, but this is not part of our current plans. This is, conversations about a contingency plan, which health officials should be doing, both those in the ministry and those in AHS.
And Quebec hit a new high for COVID-19 cases today. For the first time, that province is reporting more than 1,500 new cases. The number of hospitalizations is also creeping up. There are now 740 people in the hospital with COVID-19 in Quebec, 99 in intensive care. As Mike Armstrong explains, it's putting a serious strain on the healthcare system and the people who work in it.
There is a number hidden in Quebec's new daily record for COVID-19 cases. It's not the total, 1,500, that's the biggest problem. It's how many inside that number are healthcare workers.
Those people cannot take care of other people, and then everything shuts down, and that's the problem right now.
Quebec has 2,000 beds for COVID-19, and less than half of them are being used. The problem is it doesn't have the staff to care for patients in those beds. Part of its protocols. A lot of jobs take more people due to COVID-19, but the biggest issue is staff off work because they're sick or as a precaution.
That's the rule. We don't want to risk having a healthcare worker seeing 20, 30 patients, infecting all of them.
According to the province, more than 6,500 healthcare workers are off the job. That doesn't include burnout or people who've simply left the profession.
People at the beginning were going on adrenaline. Eventually, the adrenaline runs out.
To keep the system going, the province has been canceling vacations and forcing mandatory overtime for months. The pandemic is taking a toll, in particular, on nurses.
You know, every day they know they're going to work, but they don't know when they're coming back home.
Quebec hospitals are actually treating fewer people than usual at this time of the year compared to a normal year, about 20% less. But what has everyone nervous is whether that stays the case. COVID-19 hospitalizations are growing. Quebec started November with less than 500 COVID-19 patients in hospital, but it's been creeping up ever since. As of Tuesday, it was 740.
I want to tell the truth to the population. Right now, the trend is not good.
The danger is what's around the corner. If too many people gather over the holidays, there's fear an already dire situation could get even worse. Mike Armstrong, Global News, Montreal.
The Canadian military will not be heading to a remote First Nation in northern Manitoba, despite calls from the community's chief for their support. The situation in Shamattawa First Nation, about 745 kilometers northeast of Winnipeg, is getting worse, according to Chief Eric Redhead. He says 76 COVID-19 cases have now been confirmed and 100 are expected by Saturday. The federal government says a temporary isolation shelter has been sent to the community, and department officials have been in contact with leadership in Shamattawa about concerns around enforcing public health orders, but no military help has been committed. The U.S. Centers for Disease Control and Prevention has issued new guidance about the quarantine period for people exposed to COVID-19. The CDC now says people could leave quarantine without taking a test if they do not develop any symptoms 10 days after being exposed to someone with the coronavirus, or after 7 days with a negative test result and no symptoms. Research shows most people develop symptoms 4 or 5 days after exposure. Health Canada says it is not planning to change the rules here. Canadians still must quarantine or self-isolate for 14 days. Tackling a dual crisis coming up, the new warnings about how our healthcare system can't handle the impact of climate change. "2020 has been all about the coronavirus, but there is a deeper long-term issue going on, the health impacts of climate change. A new report in The Lancet says healthcare systems are not prepared for the increasing threats posed by a warming planet, a reality researchers call the most worrying outlook to date. As Eric Sorensen reports, they say the two global crises pose similar dangers that should be addressed in tandem.
In 2020, climate change was overshadowed by COVID-19, but that has not slowed the relentless rise in global temperatures. A new Lancet study says health systems are not prepared for the impact a changing climate will have on both lives and livelihoods. Rising sea levels will displace millions, big cities will bake, wildfires and smoke will damage lungs, drought will destroy agriculture, and excessive heat will take more lives.
We know that when it is extremely hot, people tend to die more, so there's an increase in mortality.
The Lancet study sees parallel threats from climate change and COVID-19, especially for the elderly. In Canada, people over 65 account for more than 90% of all the COVID-19 deaths since March. At the same time, people over 65 have seen a 58% increase in heat-related deaths in the last 20 years. Climate mortality statistics are more gradual, but just as real. Overall, more than 12,000 Canadians have died from COVID-19 this year. From climate change in 2018, mortality from heat coupled with air pollution, deaths exceeded 11,000. For COVID and climate, the consequences are serious. On the economy, the pandemic has cost more than 500,000 Canadian jobs this year. Less visible, extreme heat has seen 7 million more lost hours of work each year compared with 30 years ago.
These health impacts are so significant that it's going to cost more to our economy not to address them than if we take the initiative to address them in a timely manner now.
The pandemic exposed the stress on our healthcare systems, but provides an opportunity to get it right for the growing climate crisis.
We can't just tackle one crisis at a time. We need to come together and address the climate and health crisis as well.
The aim, say researchers, should be to align a COVID recovery with a green recovery.
It's kind of a triple win situation here. We have the potential to create better public health, protect the environment, and have a sustainable economy.
One more health warning: if we don't address climate change, a warmer planet will increase the risk of animal to human disease transmission. In other words, pandemics could be more likely in the future. Eric Sorensen, Global News, Toronto.
The captain of a California dive boat that caught fire and sank in September of last year was indicted on federal manslaughter charges today. 33 passengers and 1 crew member died. Captain Jerry Boylan faces 34 counts of what's called seaman's manslaughter. He's accused of failing to follow well-established safety rules. The tragedy is one of the deadliest maritime disasters in recent U.S. history. Those who died were trapped below deck in a bunk room with no way to escape the fire that broke out at night, and there was no roving watchman on board. Still ahead, how 14 countries, including Canada, plan to protect the world's oceans.
You're watching Global National.
The federal government admitted today it won't fulfill its election promise, first made in 2015, to get clean drinking water to all First Nations by March of 2021. Indigenous Services Minister Mark Miller says it was an ambitious deadline, and he takes full responsibility for failing to meet it. He says the pandemic delayed upgrading some water systems and limited access to resources. The government has committed another $1.5 billion to tackle the complex issue, but it is no longer promising when all the water advisories will be lifted.
This isn't a deadline where we'll just walk away and somehow our consciences are clear. Quite the opposite. This is a much deeper commitment to walking along the path of ensuring that communities have safe access to clean and reliable drinking water for the long term.
97 First Nations water advisories have been lifted since 2015. 59 are still in effect, and it's expected at least 22 will remain past March of 2021. One of the world's most lucrative fisheries opens this week in southwest Nova Scotia. Lobster fishers land a huge catch for export, worth almost $3 billion a year. It's a reminder how precious and how resource-rich the world's oceans are. And as Ross Lord reports, Canada has now teamed up with other nations to protect them.
The health of oceans has been declining for decades from activities like overfishing and pollution, taking what we want and putting back in what we don't want. In Canada, research shows only a quarter of fish stocks is reliably healthy. A new international effort promises to elevate a healthy ocean from the bottom of the global policy agenda to the top.
Through this commitment, each country will have a sustainable ocean plan in place by 2025.
The countries promise to improve nearly 30 million square kilometers of national waters, an area the size of Africa. If it happens, they say oceans will produce more food, more renewable energy, and ease global warming. Canada and 13 partner nations have signed on. Among those who haven't is the United States.
Their leader at the time, which was Donald Trump, didn't have much of an interest in joining this agenda. Maybe under the new administration, we do see a shift in thinking there.
The leaders say they're not trying to divert attention away from urgent priorities like stopping COVID-19. They insist the ocean can bring economic relief as the world looks to recover from the pandemic. A statement from Prime Minister Trudeau reinforces Canada's support, but some of the panel's goals are easier said than done, including making more sections of ocean off limits to fishing or drilling for oil and gas. The government that's had trouble meeting timelines for other commitments could face a challenge convincing Canadians this promise will stick. Ross Lord, Global News.
Looking beneath the numbers next, putting a human face on the toll of COVID-19. More than 12,000 Canadians have now died from COVID-19, and each day dozens more are added to the list. There are too many to name, but we know there are families across this country who are mourning. Tonight, Heather Urix-West has the story of one of them.
We just happened to turn on the evening news, and my dad's death was being reported. And it was just a man in his 80s.
It's how, since the beginning of this pandemic, all deaths have been shared. No names, just ages and genders. But for Catalin Lang, her father Jozef was so much more. So the next day she wrote a post on Facebook that's now been shared more than 2,000 times.
There are so many numbers announced every day with regards to this pandemic. Active cases, recovered cases. Then there are the numbers that people throw around about survival rates. Well, here are a few more. 54, the number of years my parents were married and completely devoted to each other.
When Lang moved to Clifton Manor, a long-term care centre down the road last year, his wife visited twice a day.
To go and sit with him and be with him and watch TV with him.
In the spring, for 3 months, those visits were put on pause. Clifton Manor experienced several outbreaks, but each time Lang avoided infection, until a single case in mid-November caught fire. It took less than a week for the virus to take his life.
By Wednesday, he started deteriorating, and by late Saturday night, early Sunday morning, he was gone.
Lang's daughter wanted to share her family's grief on social media because she knows they're not alone. There have been thousands of others, and dozens more each day, whose deaths may be reported as numbers, but to their families, they were so much more.
So tonight on the news, you'll hear about a man in his 80s who died from COVID. Know that he was loved and adored. Know that he was the beating heart of my family. And know that there isn't a number large enough to accurately sum up the loss we feel today. Jozef Lang, 1932 to 2020.
Heather Urix West, Global News, Calgary.
And we know there are so many more. That is Global National for this Wednesday. I'm Donna Friesen. We leave you tonight with a countdown to Christmas that's a little bit fishy. These penguins at the London Zoo were pretty excited to get at this advent calendar designed just for them. I'll stick with chocolate, thank you. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.